Sana Ansari, researcher at IMPRI, Impact and Policy Research Institute, Prabhav एवं नीति अनुसंधान संस्थान नई Delhi. Extend my warmest welcome to you all to IMPRI Web Policy Learning. Today, we are gathered here for day 10th of the Public Policy Qualitative Participatory Action Research Fieldwork Fellowship, Cohort 4.0, an online national winter school program. We welcome you to join with us for an immersive journey into an impactful qualitative research fellowship. The chair for the program is Professor VIBHUTI Patel ji,
Namaste.
visiting distinguished professor at IMPRI. The conveners for this program is Dr. Simi Mehta ji, CEO and editorial director at IMPRI, and Dr. Arjun Kumar ji, director at IMPRI. We have also shared the course outline and reading resources in your email for your kind attention. Before we start today's session, I would like to state the housekeeping announcement. Please join the meeting on time. There will be Q&A session after each presentation. Share your question on the Q&A box only. The question must not be posted as an anonymous attendee. Ensure that the questions are precise and refrain from making general comments in the question to save time. And to begin today's session, I would like to invite our chair, Professor VIBHUTI Patel ji, visiting distinguished professor at IMPRI, to give her opening remarks. We welcome you, ma'am, and over to you.
Yeah. Thank you, Sana, for introducing the course. And I would first of all express my heartfelt congratulations to the IMPRI team for concluding this session. We are at the now fag end of the course, where you people are now going to make presentations after 9 extremely rewarding sessions that we had. And a brief summary of what all has transpired. On day 1, we began with the overview of qualitative participatory action research, its advantages, and how it has played important role in transformative changes globally, in a region, nationally, and so many recent policies are rooted in the qualitative participatory action research. The classic example of a rapid assessment studies which were done during the pandemic and how it helped in coming up with the appropriate and target-oriented policies and intervention strategies of the state and civil society organizations. On day 2, we had Dr. Amar Jesani, who spoke on the ethical guidelines and ethical standards, and they are going to be very useful when you write your dissertation. And he talked about the various perspectives and the ethical framework where social values and some of the thumb rules of scientific validity of participatory research, he explained. He gave several examples of some of the controversial issues and the landmark case studies which resulted in changing our sensibilities and sensitivities and analytical understanding of the issue of participatory action research. He also talked about data falsification or data fabrication, plagiarism, robbing of authorship. All these are unethical behavior. On day 3, we had Professor Manjula Bharti, who spoke on qualitative fieldwork research, and she focused on case studies approach, where she talked about the semantic explanations of various theories, and she explained independent and static and dependent variables, epistemological and ontological inquiry in research, qualitative and quantitative case studies, and how qualitative research and participatory action research provides you thick data that can explain the processes that you are examining. She also talked about Michel Foucault's work on archaeology of knowledge, about methodology and historiography of the systems of thought, and which is known as epistemes, and knowledge, which is discursive formation, where the subjective consciousness, that means your own involvement in research, plays a very important role, and your conceptual system of possibility that determines boundaries of language and also thought used in given time and domain. It is very important to understand that in qualitative research, it is not numbers and percentages, but your language, your words, they are extremely important. While speaking about features of qualitative research case study, she introduced the concept of agency. We all know that so many post-modern scholars have also talked about agency, starting with Foucault and Derrida. She spoke on classification of case studies based on time retrospective, snapshot, diachronic, which involves complex nonlinear relationships between variables and the nested case studies. We had Professor Vijay Raghavan, who spoke on policy influence participatory research methodologies, where he gave his own involvement in the project of TISS, which is known as Prayas, and you must be reading the name of Prayas and its activities in most of the mainstream newspapers at least once a month, whether it is about the children's right or children in conflict with law or prisoners' rights or people who are in shelter home, what are the predicaments, senior citizens' rights, all these issues. They have used the participatory action research, and they have also worked with the state agencies and come up with the very, very doable agenda and the policies and the laws. He also said that you must put down positionality of researcher. Who are you? What are the privileges you have as a researcher? Knowing the language, your educational background, your caste and class background, and the people who are involved, your respondents in the research. And I think that sensitivity is very important. And he said that participatory action research brings as much as possible by engaging in dialogue with the stakeholders with an understanding that it is not research on them, but it is research with them. So he shared his study of forced separation of children of imprisoned mothers, and it was such a how the rapid assessment study and the bail study done by Prayas resulted in humanizing the prison authorities and bringing so many prison reforms. On day 4, we had Dr. Soumyadeep Chattopadhyay, who enlightened the participants about development, research and questionnaire in design. And he was step by step, he explained, because of his own involvement in conducting so many participatory researches in West Bengal for the government as well as for the various research institutions. And he talked about the structured, the quasi-structured questionnaire, or the designing the unstructured questionnaire, testing of hypothesis, and also relevancy of the survey, accuracy in interview schedule, proper wording in qualitative designing, and also content of the question, because the way you ask question, you will elicit the response from the people involved in from the stakeholders. So it is very making a questionnaire very carefully and meticulously designed questionnaire can have a very accurate research outcome. On day 5, we had Dr. Prabhu Punnaswamy, who spoke about the computing, technological, and artificial intelligence skills for researchers. He showed so many portals where you can freely use artificial intelligence, whether it's a GPT or Google Gemini or Bing Capilot. And he also enlightened us about the ethical standards that we need to observe. So many institutions do not allow use of artificial intelligence in the research, and you need to declare that you have used artificial intelligence and which are the programs. It is important for you as a researcher to declare that, especially when you are working for your PhD dissertation or any institution which guidelines demand that. On day 6, we had Professor Gumadi Sridevi, who spoke on qualitative fieldwork research case studies, and she shared her experiences, some very good experiences, inspiring experiences, and some extremely disheartening experiences at the field. And she talked about various types of researches she conducted with rural communities. And she also talked about the studies done by the stalwarts like Dandekar and Rath, which focused on calorie intake, while Professor Sen focused on multidimensional poverty, feminization of agriculture, Bengal famine, and how the Dr. Sen, though trained as a statistician, but it's the qualitative data which brings out, which he brought out, resulted in not only in India, but all over the world, so many systemic changes were brought in, and how the UN system and international labor organizations and World Health Organizations, FAO, Food and Agriculture Organizations also benefited from his global universe vision, which was universally applicable. She told about logit and probit models, i.e. the regression models commonly used in statistical analysis, particularly in the field of binary classification. And she also mentioned longitudinal studies, and she gave examples of a research on cognitive skills of children, which vary because of multiple factors. And she said that how different factors counteract. And she gave several examples of studies done for localization of sustainable development goals, how she got involved in a right to food campaign, which were more directly linked to the sustainable development goal of goal 1, which India is committed to all 17 sustainable development goals. And she also talked about the question of nutrition. And she gave an example of a research on urban canteens in Tamil Nadu, Karnataka, Telangana, and Andhra Pradesh. And she showed that how the power dynamics impacted common water resources, unequal wages for men and women in agriculture. And she concluded that field observations are quite different from what we get in the recorded data, and the policy should be decentralized. It should be localized because every region has a different. That study of 4 states also showed that the same theme of running of a canteen had a very different outcomes and different processes over there. Day 7, we had Dr. B. Rajeshwari's qualitative field research case studies, and she also talked about so many successful examples of qualitative case studies of Amul cooperatives or microfinance institutions or Arvind Eye Care and the Fab India model. And she explained how and why of the characteristics of case studies through in-depth explorations. And she asked the question, why do we do case studies? What do you come out with in case studies? So she said it's a coding of qualitative research. Whatever field data and the narratives you have found, you need to ask who, what, where, and how. No, that is very important, and identify the patterns and also themes which are very important for inclusion in your final report. And she also talked about the steps to codings, creation of a research memo known as an analytical or reflection memos or integral part. They are the integral part of qualitative research processes. Whatever you observe, it is not only the dialogues, conversations, and interviews, but your observation of when you go there for research, those also are very important to note down. And we had on 8th day, we had Dr. Purnima Chauhan, who talked about how she, as a bureaucrat and IS officer for the government of Himachal Pradesh, used action research and policy. They said it is very time consuming, it is very expensive, but it also is very rewarding. And she also talked about her intervention in curbing adverse child sex ratio, in curbing the water treatment plants, and also the question of smart city indicators and how Himachal Pradesh got so many awards for being very proactive, the governance structure that they created. And she ended by stating that the top-down bureaucracy is a real challenge. And she narrated a case study from Tamil Nadu in which women elected representatives, they were the one who effectively built toilet block with a community center on the top, so that once women community center is there, everyone has to pass by the toilet block, and if toilets are not clean, then they can be immediately they can take action. So local women played active part in design of the building, and then only they found the solution. So to reach to community center, women had to pass toilet block, and that's why if the toilet stunk, then there was a stinking, then they would make complaint. So this kind of a direct involvement and taking proactive effort and doing the area studies to come up with the targeted solution that was recommended by her. She also gave examples of a study tour of as a bureaucrat of Sweden and some of the municipal corporations which were extremely multicultural, and how efficiently they did the local governance. Professor Utpal Kumar De, who spoke after her, spoke on the fundamentals of qualitative data analysis, and he stated that data itself is a language. It is information presented in number. For example, income or a height of a person, or consumption of different nutrients by different categories of people, or you can analyze various socioeconomic phenomena by analyzing variables represented by data such as changes in income over the years, total output of the country, per capita income, growth of economy, purchasing power, supply side and demand side economic activities. And he also explained, like Madam Prasad, he also explained probit and logit models of econometrics and nominal, ordinal, discrete and continuous types of data with innumerable examples. On the previous, on day 9, we had Dr. Samani Meklai, whose lecture was highly appreciated by the participants. We saw so many positive and encouraging notes in the chat box and careers in research and publication. And she gave a very much a hands-on and very practical advice and guidance about the carefully carving your career path, whether it is in research or publication or editing or joining academia or NGOs or international organizations. And she also said that what kind of safeguards you need to take for getting your idea into a paper, the whole transition, and also getting it published in a peer-reviewed journals. We had a lecture by Professor Arvind Unni after that, equally engaging, extremely electrifying presentation on from action research to policy action and impact, a practitioner's approach. And he says he's the first practitioner. It is he being a practitioner motivated him to get into qualitative research. And he gave 3 examples of his involvement and how it brought the change. He gave a profile of his involvement in participatory action research of Gulshan Nagar Basti development in Patel Nagar in Delhi, and another one M Ward in Mumbai. And he also talked about the whole question of a displacement and relocation of people. He also shared his experiences of research in connection with the Mumbai Development Plan, which is the mega development plan of a city under the Smart City project, and on existing land use and the proposed land use with the help of affected people, and how the gap between existing land use graph and the figure which the state had given, and when the community, they said that so many things were missing when the bureaucrats prepared the plan. So training to people ensured their active participation in mapping, and a lot of things were rectified in the Bombay plan because of the intervention. But he also lamented the fact that the same effort with the Delhi Development Authority did not bring any result. So in one city, they got a good response, while in other city it did not. And the process opened up a discussion and bigger debate, which got amplified at the level of Delhi city state, and also the Indian Society of Indo-Global Social Service Society. They also backed this endeavor. And he talked about 6 important projects in which he was involved. And he talked about 2 types of research that is applied for public policy. One is a participatory approach to research, and other one is a practical research. So he said that when you talk about the urban master plan and informal settlement, critical analysis of inclusivity, it was a participatory research. Community-based disaster risk reduction in Chennai slum, it was a practical research because immediately the state had to respond. Local authorities had to respond to what kind of measures they to take. So all researches, qualitative researches, are not participatory. There are some are participatory, some are practical. Smart cities mission, analyzing progress and challenges in implementation, or reduction of urban flood risk, or impact of post eviction on livelihood and social networks, and participatory housing designing, all of them have potential to be participatory, provided the state agencies are sensitive. So I think this was a very important learnings we had in these 9 learnings. And I think today we will see how you are applying them in your presentation. Over to IMPRI.
Thank you, ma'am, for the quick yet very comprehensive recap of the previous section. Without any further delay, we would like to begin with the presentation by the fellows, and each participant will get 5 minutes to complete their presentation. And now I would like to request Hetwi ji to go ahead with your presentation. Hetwi ji.
Yes, they are there. They at the moment they don't have the access to panelist link. We'll be giving them the access now.
Okay, ma'am.
I request the participants to accept the promote as panelist link and then rejoin the webinar.
Good morning, everybody. I hope I'm audible.
Yes, yes, you're audible.
Great. I'll just quickly be sharing my screen as well. Just a second. Is it visible?
Yes.
Or I would just need a moment. Before I begin, thank you so much to Team IMPRI for the support and guidance that I've received throughout the course. And Professor VIBHUTI mentioned something earlier, how quantitative research is just a language of sorts. And everything is focused highly on the way we are framing it and the way we are talking about it. And I think my research is quite aligned, at least my topic, I would aim for it to be quite aligned with what she had mentioned previously. The research topic that I've picked is called Desensitization of Violence, Sexual Violence in India. The research topic focuses on the representation and the misrepresentation of sexual violences in India, and specifically the Mumbai narrative and the Mumbai landscape for how media has portrayed sexual violences in the last 10 years, I would say. To begin with, the question that I'm trying to raise with this research is if there is a desensitization occurring right now within the media landscape around sexual violences, and if there is a sort of lack of empathy that is being created among the masses and the rest of the audiences and the viewers of this particular kind of media towards sexual violences in India. I'll be focusing on 4 major points, and towards the end of it, if we do have the time, I would like to do a small exercise with my fellow researchers and the rest of the team IMPRI, where I'll be asking a question and it'll be open-ended, and everybody would be able to give me their inputs on the same. The context of this research is that there are as many as 47,381 crimes against women in Maharashtra towards 2023. And this is a jump from 2021 and 2022, which is around the COVID time where there's still a lot of restrictions and there's still social distancing being maintained. I believe that has a correlation here. And according to the economics, that's according to the economic survey, the crimes against children also increased to 17,232 in the past 2021 and from 2023. As per the Mumbai police record, so this is the significance of this particular data, that between 1st January 2024 to 31st January 2024, there were around 60 rape cases registered within Mumbai police stations. And all of these rape cases, out of these, 18 were resolved, 18 weren't considered, and the remaining ones were considered to be and taken ahead. The procedures were being maintained. This particular data is specific because how many of us have heard about any of these rape cases except for the significant ones that have happened in Thane and another one that has happened on the outskirts of Mumbai, the 5-year-old rape case at the station. There is a lack of awareness among Mumbai media around their own. City reporters have had experienced a lack of reporting for Mumbai specific cases in comparison to cases that have been glamorized of sorts almost. For example, the Kolkata doctor rape case has been talked about a lot, and one of the reasons being it is brutalized. The case that had happened is one of the extremities of the extremities, and it is fatal. It was fatal. With There is a lack of understanding within the media what to report on and what to not report on often, because they are also leaning towards more glamorized and more popularized rape cases just for that clout, as we consider it. There are a lot of policies that are existing within the Indian government's Indian laws that prevent a lot of victims from being named. For example, the POSCO Act, media must ensure the privacy of victims under 18 and avoid sensationalization and prohibiting disclosing the identity of the minor victims. There's the Indian Penal Code Section 22(8)(a), preventing the publications of rape victims' identities to protect dignity and privacy. There is the broadcasting standard of the News Broadcasters and Digital Standards Authority, NBDSA, where they encourage ethical and sensitive reporting of sexual violences and calls for avoiding sensationalization and maintaining victim anonymity. There are multiple other policies that are into place to prevent the victims from being addressed shamefully, or to protect them from media scrutiny. And these have been into place for a very long time. However, media has, and on multiple occasions, attempted to go above and beyond to procure that information of the minority, of the rape victims or the sexual violence victims, to basically sensationalize them. I'm sorry. I would like to.
I'm sorry to interrupt, but 4 minutes are up.
Oh, okay. So I'll just fasten this. There's a report done by Pari. It's called the Sexual Violence and News Media. It's entirely focused on the way that media has reported, uh, sexual violences. The two case studies that I specifically wanted to talk about was the Nirbhaya rape case and Kolkata doctor rape case. I mentioned the Kolkata doctor rape case in comparison to the Mumbai statistic right now, but the Nirbhaya rape case has put a lot of, it has acted as this sort of, majority of the headlines that we'll see are another Nirbhaya in Delhi rape. She's being used as this tool to have she's being used as a tool to reflect on the people that are coming after her. And she's being used as this news peg, as people call it in the newsrooms, to sort of even more brutalize the way people view sexual violence. And that is creating a desensitization among human and everybody else who's viewing these news. The current narrative in Mumbai is there is an exposure to the stories of violence led, and which is leading to the lack of empathy among everybody. And the language that is being used is extremely, extremely desensitive. And there is a lack of gap in representation. This is where we see how people who come from, how people who have been brutally raped and murdered are being sort of used as media and news pegs, and they are not even considered. There's a complete disconnect between the viewers and the media and the victim herself. Majority of the time, that they are unable to sort of humanize that person, that victim. Victim is the term that they sort of lean towards as well. About the research, the professions that I'm trying to lean into are journalists, editors, media houses, shaping the stories that are being, which are representing these cases. And the ages are between 15 to 40. The methodology that I'll be using is interviews and Google Forms. The key stakeholders that I'm trying to get an insight from are journalists, sexual minorities, journalists, and media associates, government stakeholders. That would be it. I think, is my time up, or do we have a little longer?
Time is up.
Okay, thank you so much.
Now I would like to hand over to our chair and Simi ma'am for their comments. Ma'am, you're muted.
I think one major denumbing factor of media portrayal is that as you said, that it is sensationalizes and also creates a paralysis, no, that you just can't do anything about it. So I think some of the stories, no, like why doesn't media project so much of happening at a ground level, hand holding, solidarity, support to this thing, the work which organizations like Majlis do. It's not only Majlis, but there are so many such organizations. So women who have rebuilt their life, no, in the midst of adversity, why that doesn't become a focus? Because that would give energy and that would give confidence to many other women in similar situation. So I think some of the stories of empowerment or stories of how different people can play pivotal role in supporting the survivor, whether it's one phone call or from neighbor or someone just giving the information on anonymous information on the website, because that's what the ministry also has. Simple steps, no, of social solidarity can completely change the reality from death, from misery and tragedy to rebuilding and empowerment. No, so I think those type of stories, why doesn't media publish? No, so that question also I think you should include.
I 100% agree, but ma'am, the way we are currently viewing, the news, there is people are chasing numbers. The media and the journalists are chasing numbers and how many more people will view their stories and view their news. That has led to a lot of people just focusing on the negative, because it's called the bad word syndrome, if I'm not wrong, where people continuously watch and consume negative media because it becomes a pattern of sorts, and that has been happening in India for over the past 10 years, I believe. That one of the reasons, but I completely agree with where you're coming from, that why are more positive stories not coming out of, why are more survivors not coming out and being given the platform to be able to speak about what they've experienced.
Yeah. But I
Would
think
you want
that
me to
can go
include
as a
this in my
recommend, because
question?
once you start no recommending such thing, people
Yes,
catch
ma'am.
up this idea and they also start demanding. So in course of time, things change. No, yeah. Because earlier we used to kind of reporting we used to see during 80s and 90s, it was nothing but the even stories written by because feminists at that time were celebrity, no, so they were invited to write, but the image that would go with the story would be so objectionable and horrifying, no, even we ourselves felt ashamed that why did it go, why did we write for this prestigious journal, and they have just completely messed up whatever. And looking at the image only, you would feel that okay, this must be some sensational and
Glamorized.
yeah. So that has now reduced. You can see even increasing number of male journalists writing very seriously about the question of it. So things are changing little, but because constant hammering is required. So I think this is also very important, and also the criminal justice system, because they also keep on giving press releases, no. So I think what we need is a training program for the media department of police and media department of court and media department, because they are
There is a
they have
guideline.
such a outmoded ideas, no, about that's what we say, that okay, you don't write FIR, we will make copies, we will bring 3 copies to the police station, you take one, we will take one, and we will get it stamped and this. Otherwise, what you are telling and what they are writing is that there is no connection between the two, no. And if that version goes to the court, obviously your case will get dismissed.
Ma'am, would you suggest I add the recommendation that you just mentioned about how we can celebrate the survivors and their ability to go ahead?
Yeah,
In my
project.
question,
Yeah. Celebrate we won't, right? Because there's a question of violence. So there's hand holding, social solidarity, and
social service.
the whole process of empowerment that takes place when people are supportive, no, and creating a positive ecosystem. I think those kind of stories are very important. Currently, we have very few, and that too, like Flavia stories translated in several languages, but it's the civil society organization which has done. But there are many such this thing who have been very, very heroic in their fight against multiple adversities, no? And I think that should also come out. It's not only this detail, because that woman, why do we call her survivor? Because she despite this kind of atrocity, she has managed to reach police station. That itself is a big task, no? To muster courage to make it public, go to the police station. That itself shows that she has a instinct to survive, and little support from neighbors or relatives or civil society or media can really help us to rebuild her life. No? So I think rebuilding the life also should have an equal weightage in the media reporting.
Also, ma'am, there is by the National Human Rights Association in India, they have also shared a guideline on how media is supposed to be representing sexual violences in India.
Correct.
I would like to take that for my
And also Supreme Court guideline.
Supreme Court guidelines.
That is also what language you should use. It is not only for judges, it is also for the media.
Media.
The kind of language that you need to use, or what is being used currently, and how the change has to come. So I think that is also very useful. And about sex worker, there was a objectionable, some terms were there. So the women's organization opposed, and after that they revised that guideline also. So now we have a latest guideline of the Supreme Court of India. That's also in public domain, can be easily downloaded. Yeah.
Thank you so much, ma'am. Thank you, Team IMPRI.
Would like to hand over to Simi ma'am for comments.
Yeah. Simi ma'am is.
We can move to next, Sana. Some connection error.
Okay, sir. So next, I would like to invite Ashi ji to please go ahead with your presentation.
Good afternoon, ma'am. Good afternoon, IMPRI team, and good afternoon to all of my co-fellows. I'll go about and share my screen now. I hope my screen is visible and I am perfectly audible.
Yes, yes. The screen is visible and you're audible as well.
Okay, thank you, ma'am. So my topic is tackling patriarchy at work, a comparative analysis of the narratives of women officials, principals, and teachers in Ajmer and
Madam,
Dungarpur.
make it a slideshow mode. This is working mode. Yes.
Is it okay now, ma'am?
Yes.
Okay, thank you. So my topic is tackling patriarchy at work, a comparative analysis of the narratives of women officials, principals, and teachers in Ajmer and Dungarpur. Now, why Ajmer and Dungarpur is because I have been working for the past 1 year in Ajmer, and now I am currently posted in Dungarpur, and I have seen the stark differences between all of the officials and the working pattern in these two districts. While Ajmer is a rapidly developing and near to the capital, that is Jaipur, a pilgrimage site for Hindus, Muslims, Parsis, and Jains as well. But here, Dungarpur is still trying to balance itself between Rajasthan, Madhya Pradesh, and Gujarat, and also quite struggling to keep its tribal ethnicity as well. So my research statistics are for the officials in education department, I have taken 5 women officials. There are 10 principals, 5 from Ajmer and 5 from Dungarpur. There for the newly appointed teachers from 2023, there are 5 from Ajmer and 5 from Dungarpur. So the total number of recipients here are 25. For the officials in education department, I have taken 3 from Ajmer and 2 from Dungarpur because the presentation of women in the workforce in Dungarpur is still a little behind. For the narrative of the officials, in case of Ajmer, there is existence of, as per their narratives, what they have told me, or they have self-reflected, is that there is still a existence of a bias regarding the capability lingering till date, even after 15-20 years of working in the same office and leading successful projects. They're constantly judged on the basis of their choice of clothing and caste as well. But here, if we come to Dungarpur, The women workers here they are being the first generation of women to receive formal education and join the workforce. It took some time for the workplace to become inclusive, but there was never any lack of respect or any doubt regarding capability of the officials based on their gender. Here, the women officials have always pointed out that they are all from the tribal castes. So there was never any caste divide, which they feel is one of the most stronger points for them to have been accepted in the workplace. For the narrative of the principals, in case of Ajmer, we have there are male teachers who come from politically influential background who refuse to follow any new practice or innovation introduced by women principals in the schools. Same goes for male headmasters who show resistance when the female PEOs give their feedback during school inspections and meetings. Also, despite several trainings and one-on-one, some teachers have a deep-rooted gender and caste bias in their mindset, which affect the students, also especially the girls in the schools, negatively. I have personally faced during my community immersions that there are people from low caste, there are people from the Gumantu traditions who have just dropped out of schools because they have been constantly pestered that your family, your father, your mother, they are Rakpikas, so you will eventually be a Rakpika, so why are you studying? And such type of comments from the teachers as well, which has led to even dropouts in Ajmer itself. Whereas if we come to Dungarpur, the staff has mostly been welcoming and very obedient whenever any innovation has been brought in by the principals or maybe the PEOs. Also, majority of the teachers, irrespective of the gender, come from ST backgrounds and have suffered the reluctant government education system, and so they strive to give their 100% to the classes. The narrative of teachers here, for the case of Ajmer, if they are PTI or BCI, here PTI is the physical training instructor and BCI is the basic computer instructor, or STEM subjects. Here by STEM I meant maths or science subject teachers. They receiving taunts from the lecturers. Here lecturers are class 11 and 12 teachers, and male colleagues is very common. If they are from ST, SC or OBC background, age and cutoff score relaxations given in the government examinations are often thought to be the only reason they have qualified for the post. And the way of clothing is judged even if they maintain a formal decorum and shift away from the traditional sari. In Ajmer, it was a very surprise for me. I have seen teachers take class in their pallus, still covering their faces. And that was considered very normal in Ajmer, which I have never faced in Dungarpur so far. For the case of Dungarpur, some male colleagues have a pre-existing bias but are hesitant to admit it because the headmaster, the PEO, and the other teachers are open-minded. There are many young women who are working with several NGOs as REI partners, and their efforts can be seen on the students' performances, which inspires us to keep working and influencing the next generation of girls who will soar higher and than us and achieve higher limits. This was what the new teachers in Dungarpur has expressed to us. Here are my insights.
Ashi ji, 4 minutes up.
Yeah, thank you. I'm on my last slide. The insights drawn by myself here post my research are it will be a long battle indeed, but the educational institutes and the department as well should be politically neutral. Training and workshops should be constructed in an active manner such that the individual is empowered to question his or her pre-existing biases in own mindset. And interventions by REI partners should be increased to make the school a more just and equitable learning center for students, and a state like Rajasthan, where even today we're battling with poverty, illiteracy, child marriage, and inherent patriarchy. Thank you, and that's all from my side.
Thank you. Now I'd like to hand over to our chair for our comments.
Yeah. I think hello. Yes.
Yes,
This you are going to give also the demographic profile of the region,
yes,
both. Huh?
Yes.
Achha, that you will get. That means you are going to triangulate, no, the data, both
Yes.
the quantitative data which is there in the official records, and
Yes.
which would be like complemented with the findings on the ground, no? Hello?
Yes, ma'am. Yes, ma'am. Yes,
Hello?
ma'am. Am I audible, ma'am?
Yes, yes.
Yes, ma'am. I'll do that. I have the data and I'll do that.
Okay, okay. And you are going to have a FGD or individual interviews?
Individual interviews, ma'am. Case
So
studies,
20,
but I
25
will,
of them you'll have to have.
yes, ma'am. And I'll not be revealing any of their names because they are still in service.
Yeah.
But it was a very fruitful research for me.
Yeah.
This is not only what only I have spoken to them. This is also something which helped me reflect that for the past 2 years, how had reflected, how I could see the certain changes there. And also, I would like to add that there are many NGOs who are working in Rajasthan, where we can see fresh talents who are coming from outside of Rajasthan. So we could see that what is surprising the outside people, and how is that helping the existing cultures and existing predominant some cultures, uh, how it's countering and helping them break it, when constantly there are young girls who are coming, who are working, and who are also inspiring the if I give an age demography, it's from 40 to 55. It's hammering the principles, like how these girls are coming and they're working from my school, they're working for the betterment of my school, so even I should work for my school, for the betterment of my school. So we see that zeal. But also here, I would like to point out that the trainings that are conducted either in RSCRT Udaipur or in the other diets, it's a very one-way method still that's being followed. Even we have taken facilitations, and we have seen even teachers are very comfortable with the one-way facilitation, which hits me very much. I come from a convent background, and I have always been engaged in two-way conversations. So I know the power of two-way conversations. I know how fruitful it is, for how effective it is if it's a two-way conversation. So including those kind of conversations in the workshops itself is something I feel will definitely bring a change in the education
Yeah.
system, in the mindset of the people.
Yeah. You will have to anonymize schools also, huh?
Yes, ma'am. Yes.
Yeah, otherwise that they will be able to identify people.
Yes.
If they are telling any problems and challenges.
Yes, ma'am. It will only be mentioned Ajmer and Dungarpur, and nothing else will be mentioned.
School A, school B, you can do like that. Yeah.
Okay. Okay. Sure. Okay. Thank you, ma'am.
Thank you.
Private or public, you can qualify. It's a private school, publicly aided school.
All are public schools. Okay. Thank you, ma'am.
Thank you, Ashiji and VIBHUTI ma'am, for your comments. Now we have Harshita ji. Requesting Harshita ji to kindly go ahead with the presentation.
Yeah, good afternoon, everyone. Is my voice audible?
Yes.
It's audible.
Share my screen. Is the screen visible?
Yes.
Yeah.
Just a second.
Double click to enter full screen mode. Yeah.
So, one second. There's some issue with it. Just a second.
What's the title? Show the title slide.
Yeah, sorry. There was some issue with it. So the title of I'm Harshita Charin. I'm presenting my topic on navigating policy and enforcement, a mixed method study on the street vendors awareness and challenges in Deonar, Govandi, East Mumbai. So first, understanding like the Govandi area in Mumbai. So this is a place where I have been working and studying for the last 4 to 5 years now. So it is located on eastern suburb of Mumbai, Maharashtra, and is known for its the largest dumping ground and the abattoir. It has a lot of, it has two prominent institutes, which are the Tata Institute of Social Sciences and International Institute of Population Sciences, along with multiple offices and premium residential complexes. So coming to about a little bit about the street vendors in Mumbai. So street vendors are the self-employed workers in the informal sector who offer their labor to sell goods and services on the street without having any permanent built-up structure. According to the government of India, there are around 10 million vendors in India, of whom 250,000 are in Mumbai. And they play a dynamic role in the urban economy, mostly providing necessary items which are both durable and cost effective to the average income earning households at cheap and affordable rates. Around 30% of Mumbai workforce buys at least one meal a day from the vendors, which has been found by a study by Bhomik in 2001. So what are the policies and acts for these street vendors, which was the main aim of my study, to understand if the street vendors know about it. So there was a national policy on urban street hawkers, which was introduced in 2009, and it was for recognizing and regulating the street vendors while ensuring their rights and livelihoods. Following that, building on that itself, the Street Vendors Protection of Livelihood and Regulation of Street Vending Act 2014 came about, which legally protect the street vendors from eviction and harassment. It worked towards establishing town vending committees, issuance of vending certificates, and demarcation of vending zones to balance vendors' needs with the urban order. So the government of India gave this work to the state governments, because I think each state has a different way the street vendors work. So it was given to the state government to regulate it. So the objectives of my study were to understand the awareness of the street vendors about these acts, the challenges they face in their interaction with the law enforcement and creating their licenses, and the perception of the consumers, who are a lot, including me, regarding the street vendors. So regarding awareness of the act, I interviewed around 12 street vendors till now, and there were a combination of men and women. Women were less. There were number of men. They were fruit sellers, they were pani puri sellers, they were coconut water sellers, and even the ones who provide lunch meals, like during the meals, like the proper meals during lunch. Okay. So awareness gaps. So the vendors usually lack awareness regarding the act and protection that it offers. There were only 2 out of the 12 vendors who had licenses. There were a few who knew about the license system but were unclear about the process of getting it. And there were also 1 or 2 who were using borrowed licenses of the people who were working before them in that place. Most of the vendors, they did report that they were giving money to the police officers or the BMC officials when they came about, and they assume that the fees that they are paying can substitute for the legal compliance. So what are the challenges that they faced with the law enforcement? So most of the vendors did report the occasional harassment and fines and the demand for bribes. And for some, despite having licenses, they were fined. The vendors had a confusion about where to legally operate. So there's an area in Deonar which is like mostly filled with, it's in the center of a main road, where there are around, I think, 7 to 8 street vendors working like in a very big union kind of a feel. It gives a very big feel. And there are the lunch places, there are fruits, there are pani puri walas, there are vada pav walas, there is everything. So they set up shop wherever they feel that they attract the most consumers, and that was the area which was filled with a lot of street vendors. And the vendors face difficulty accessing or retaining spots because of the competition and the unclear allocation mechanism that exists. So what were the challenges? The four,
Shraddha 4 minutes up.
yeah, I saw. Sorry, I'm running away. So with that, I also found there was one vada pav wala who had a food license, a fire license, and he knew a lot about the licenses that he needs. But still, he said that that police walas come and they kind of hint that they need money from him, and then he pays them. This is mostly because of the traffic problem that it creates. What were the consumer perceptions? So there, it is a convenient and affordable place to have snacks, to have lunches for the number of students and the working people here. They don't have a problem with the hygiene. They are very happy with the way the people keep their stalls clean. And a lot of them had already observed police and the BMC officials taking hafta. So these are the broader challenges: lack of awareness campaigns, financial burdens because of paying the fines, gaps in the policy implementation, and the lack of data and mapping of the street vendors, which hinders the effective policy implementation, which I have taken up as a recommendation, because the policy is not very nicely implemented in this area, at least which I have observed. I was also hoping that we could develop apps or platform there where vendors could register and make it a little bit online, because a lot of them use PhonePe and everything, and they have gone into the online system. So this could also be something that can be done. And thank you.
Thank you, Ashita ji. I would like to hand over to Chair for her comments.
Harshita ji, we have been in touch for this thing, and we have also exchanged so much of literature, emails and all. It has come out very well. Only thing in your recommendations, I think you clearly, all the recommendations should flow from your study. So I think you can classify your recommendation to the local self-government bodies in terms of the policies that we need to have about hawkers in terms of implementation. And also what has been the response of the labor court, and what type of how the unions are operating. So these 4 types of recommendations you can have one for the local government authorities, one for the national level legislation. What are the loopholes and how can they be sealed? The third one can be for the labor court, and fourth one should be for the trade unions
Sure.
or the hawkers associations.
Sure, I'll do that. A lot of them here, they are very new, like for the
Yeah,
last 1 or 2 years, they are
that's what.
working. And
Yeah.
it usually regularly changes, the people change. And so they will like, a lot of them will like, कि कुछ होता है क्या, ऐसा यूनियन है क्या,
फिर
हम
भी now अभी तो क्या है information technology आने के बाद which even if you change the place and if you are in the loop you can be in touch with other hawkers,
but
no,
a
in
lot of them do not
association.
know about it.
Yeah,
So
so
I'll try to interview some more. This was what I could
because
do.
e-registration and the status of e-registration also, no, because it began in 2022. So
Yes,
in last 2 years, what has been the improvement in terms of e-registration? Because once you are e-registered, wherever you are in India, you can have access to whatever developments which are taking place, no?
Yes, ma'am. Okay, I'll interview some more. This was what I could interview till now, but I'll go for that more and maybe get the information regarding these.
Kamgar Hak Sankarsha Samiti, are you in touch with Jamila Begum?
No, I could not, to be very honest, could not get in touch with the stakeholders very properly. But I'll try to do that before I have to submit the
Yeah,
report.
because she visits TISS quite often and she stays in Govandi only.
Okay.
So she can tell you the latest thing because they are the ones involved in e-registration, no?
Okay, ma'am.
Yeah.
And could you repeat the name once?
Jamila Begum.
Jamila Begum. Okay, sure, ma'am.
Yeah.
I'll try to contact her. Thank
Should I share her details in the
If
WhatsApp
possible.
group?
Yes, ma'am. The email ID will be perfect for me.
Yeah, I'm doing it.
Thank you so much, ma'am. Thanks a lot.
Thank you, ma'am, for your comments. Now, next we have Nandana ji. Nandana ji, kindly please go ahead with your presentation. Yes, the screen is visible.
Yeah, are you able to see my screen?
Yes, it is visible. Can you please do it full screen?
Just a minute. Okay. Is it visible?
Yes, perfect. Thank you.
So good afternoon, everyone. It has been an incredible 3 months, 4 months journey learning about how to do qualitative participatory action research. Thank you, Vibhuti ma'am and IMPRI team. So my research title is on understanding and exploring the caregiver well-being. So here, by caregiver, I mean the parent or the family member, the mother or the father of children with typical or developmental disabilities, and also the special educators who often step into the shoes of being a primary caregiver to these children. Before I begin, I want to set up the context of what do we mean by autism spectrum disorder or a divergent community. So, autism spectrum is a condition and a part of the neurodivergent diversity spectrum, where the way the brain processes information is very different to that of a neurotypical child. Meaning the way the individual with the condition communicates, behaves, or even perceives the environment or interacts socially is very different. The brain is wired differently, and hence caregiving for these individuals take a full time. It's kind of a 24-hour job, and it takes specialized knowledge to take care of these children, and it takes a lot of patience, perseverance, and also courage to navigate the complex journey of caregiving. In India, under the PWD Act, there are about 21 types of disabilities listed. But autism spectrum disorder, which is the focus area of my research, is a kind of disability which is often perceived to be as a misbehavior. It's a non-visible disability because you can't see. There are no typical features or physical features of being autistic, if not the child also has some other comorbidities. Yeah. So the journey of this research has been a kind of a journey by itself for me, because there were so many literature reviews around caregivers, around special education, but it was very global perspective, very limited on the Indian diaspora and the Indian context of caregiving and well-being. So I also had to understand the concept of well-being, because it's a very subjective it can be subjective, but what are the foundational theories or frameworks of well-being these researchers were looking at, which helped me dive into the forest of interviews or field work. But I couldn't cover every aspect of it, but it gave me an understanding on the kind of diversity of perspectives that is required to understand the lived experience and journeys, from novice mothers to experienced mothers, from novice special education teachers to experienced teachers who are now advocating for autism, and which further helped me to understand and develop and immerse myself into the empathy, which is an ocean by itself, because there are so many findings which I'm still kind of understand and classify and categorize on what is known and what is unknown, and what are the root causes of these problems. um, I began with understanding the stakeholder of this ecosystem. As I said, it can be very complex, and getting a multi-dimensional view of the lived experience is very important, because the well-being is not only dependent on the self of or self or the agency of the caregiver, but it's also dependent on the circle that they are living in, the world they are living in. So the circle can grow about from the immediate circle, which is their immediate kins, family members, friends, the school environment of the child, or the special education teachers or the therapists that they are visiting to, and it can expand to the circle of influence, to the people who are advocating for autism or building that support network for helping these caregivers to kind of navigate their journey. With this, the highlighted ones are the people whom I have been, or the roles I have been able to get into a conversation and interview with, which further helps me to understand the areas of inquiry. So, for example, for around primary caregivers, my areas of inquiry were understanding their daily lived experience, their well-being narratives, mental models, a kind of intersectionality of roles that they play, right? Being a mother, being a wife, being a maybe a special educator also, and also what their identity and meaning making means to them, right? And also understanding the access to the support. So likewise, I had to
Sorry to interrupt, Nandanaji, 4 minutes are.
all right. So moving ahead, there were some thematic areas around the literature review that I have done, but as I said, the gaps existed in terms of the underexplored demographics. Indian diaspora was not a finding that I came across, but there were areas which I wanted to focus was the lack of co-creation of well-being interventions, what type of intersectionality of care giving roles exist, also the relationship and dynamics of the entire ecosystem with respect to the well-being. Yeah. So my findings moved from what we see as an event is the caregiver's burnout and their depression and the symptoms, right? But what I was able to uncover was the mental models of these parents. So one critical mental model existed, that impact of denial, the phase of denial is can prolong for long period, but moving away from it, coming out of it was very important, especially for the child and for the entire family and the well-being of the mothers as well, and the acceptance and connections of the parents, and it helps in improving the bond between the parent and the child. And acceptance is not a one-off event, it needs work to do, And denial can also relapse when autism takes new form, especially in the adolescence year. So the autism features hits when the child grows into an adult, and that is where the parent can also, come back to a denial phase. Societal perceptions is a critical factor for improved well-being, because the lack of awareness and empathy about autism in the broader community can lead or leads to social isolation for the entire family. And also parents describe the needs of inclusion through play, education, and broader community interaction, because it's not being spoken enough. Importance of partner support in caregiving. Often we are seeing that mothers are the anchor of doing everything for the child, whether it's running to therapy, taking the child to the different medical appointments, or related to education, investing time around it. So an importance of partner support on what roles does these fathers play, and can there be an open line of communication, can there be parental alignment in the caregiving journey from the both these partners. Having a marathon perspective, parents who adopt a long-term perspective of their child report feeling to be more empowered and less burdened, because it's not a race, it's a marathon. It takes time to see changes in this child. And also, the parental approaches of caregiving should be evolved, right? It's evolving nature, how to, because as the child grows across different stages of development, the caregiving style also needs to be adapted. And several parents have also transformed their role and found meaning and purpose into that of advocating for autism. They have changed their profession, now have become and trained themselves to be special educators also. There are some systemic structures that needs to be taken care of. Like for example, many parents have reported the feeling of being let down by pediatricians, because the pediatricians are not trained enough to find these features, or they mostly highlight it as a misbehavior or delayed developmental milestones. So how these pediatricians can be empowered enough in the diagnosis and the screening of these symptoms. And the need of good support network across different developmental milestone and different stages of caregiving is also very important. um, but what I found is, while the parents journey or caregiving journey is also very much interconnected to the special education challenges, the way the parent teacher collaborates, like for example the special educators, how they are, and the parent have an informed and strong relationship also can influence the caregiving a burden. Active engagements of parent teachers are needed. It can help in reducing stress and also foster a supportive environment for the child. Parents from rural and traditional social narratives also can have a lack of the disability, understanding the disability deeper. So this is the role of the teacher to be much more cultural, develop cultural competence on understanding what is required and how do I communicate with the parent from a different cultural background. Special education challenges like misunderstanding and underlying roles. Many teachers have reported that they face challenges in advocating for students within the system, because their role on the mainstream school as a special educator is not very clear. The role is not clear for the leaderships also, and there are also a little bit of undervaluing of these roles within the
Nandana ji, it's almost 8 minutes, so please can you wrap up?
yeah. So I'm just concluding. So there are other related findings around the dynamics, some policies around if there can be respite care or eligibility age criteria for the special educators. And here are some voices on the field. Yeah, thank you.
Thank you, Nandana ji, for your presentation. I would like to hand over to our chair for her comments.
think you have made a very systematic presentation, Annaji. Just wanted to know whether you're going to critically reflect on the law or the legal provisions and some of the social protection measures with the state has taken.
Yes, ma'am. I have not been able to connect with people who are, maybe I'm going to connect with one person who is, in the policy drafting committee and is also an advocate, an activist of autism. So, under that perspective is missing, because what I have been able to capture is the lived experience of parents and special educators, but the systemic lens is still a gap in my findings.
You are in touch with the special education teachers also, professors and all?
Yes, ma'am. One more area which I found a gap right now is the special education, the RCI curriculum and guideline, and also the what I have found one is the small city special education teachers need a lot of preparedness and empowerment. Because right now the RCI curriculum, the way it's designed, it's there's supposed to be theory, but it's completely relied on the person who is wanting to become a special education teacher. There is no theory, there's no practical aspects of the curriculum, and they are left upon themselves in an auto learning mode, where they're referring to Google University to learn and become special educator. Another aspect is the age criteria is right now 18 years for, so can it be also increased, because becoming a special educator itself requires a lot of understanding of the self. So that aspect is also needs to be taken care of.
Yeah. There is a tremendous shortage also of teacher, because the SNDT we have course, we don't get more than 30 seats, and all
Yeah.
30 are employed before they get result, because
Yeah.
everybody needs it, no?
And one more thing, ma'am, the kind of participants I have got is mostly from the urban communities, the semi-urban tier one cities mostly. So the special educators on tier one cities, especially from good colleges, also makes a difference. And most of them, because they are not very compensated well here in India, there's a tendency for them to pursue higher education and go abroad and settle there.
Yes, that's what we have also experienced.
Yeah.
That's true. So you can write some of the challenges also, the whole SWOT analysis you can put. It's a very good systematically done work. Yeah.
Thank you.
Okay.
Thank you, ma'am. The next we have Shubharan ji.
Yes.
So kindly please go ahead with your presentation.
Yeah. Is it visible?
Yes, it is visible.
Yeah. Okay. So, good afternoon, everybody. So basically, my research title is Mental Health and Occupational Stress Among Delivery Executives in Bangalore. Yeah, I'm using hotspot. There is a bit problem opening the video. Is it okay?
This term delivery executives is used by the employers or by the portal, like by the agencies?
By the organizations, the quick
Organization, their designation is delivery executive?
Yes.
Okay.
Basically, they are the person who bring to us the products or the services within 10 minutes, 30 minutes.
Yeah,
like
but generally they use it, popular term is a delivery workers, no? Or e-workers or e-commerce worker.
normally
First time I'm seeing this as an executive as a term. Yeah.
Yeah, means we means it's like giving them respect, dignity of labor, and this is the designation is mostly used around the e-commerce organizations for them.
Okay. Okay.
Yeah. So basically, the research title is Mental Health and Occupational Stress Among Delivery Executives in Bangalore's e-commerce startups, a qualitative exploration. So now Bangalore, why I've taken Bangalore? Because Bangalore's rapidly expanding e-commerce sector has created novel challenges for delivery executives. who serve as the backbone of last mile logistics. So this study focuses on delivery personnel employed at B2B e-commerce, unicorns, last mile hub. So basically I've selected a B2B e-commerce hub, means one organization, last mile hub in Chamrajpet, which is in Bangalore. So by examining the interplay of workload, strict delivery timelines, customer expectations, and economic pressures, it seeks to illuminate the lived experiences of those workers and yield actionable insights into their mental health and well-being. So these are the research gaps. While a substantial body of literature exists on occupational stress, several specific gaps still remain. So while I was going through the papers, I found that there are four main things, which are underrepresentation of the mental health in the gig economy. Like those who the basically they are part-time only. No person works for till the age of 60 in this type of roles. So much of the current scholarship generalizes gig workers, paying insufficient attention to the distinct stresses that delivery executives in urban logistics encounter. So normally most of the focus in the research gap I found was for B2C, business to consumer, not B2B, e-commerce. So this existing research commonly centers on B2C models, overlooking the unique operational demands and stresses inherent to B2B e-commerce logistics. So another is limited qualitative insights. Most studies adopt quantitative measures like taking questions and then putting it into a lot of churning out lot of statistical data. Qualitative I have found very less, leaving untapped the deeper narrative driven understanding that qualitative inquiry can provide. So a neglect of the urban dynamics. Few studies consider how urban infrastructure, traffic congestion, considering Bangalore, and strict delivery windows shape the mental health challenges faced by workers in densely populated cities like Bangalore. So if we talk about the review of the relevant literature, this study builds on a multidisciplinary foundation like occupational stress and mental health, stress in the gig economy, urban work environments, and despite these contributions, the distinctive experiences of B2B delivery executives in Bangalore's dynamic e-commerce sector remain largely unexplored, thus providing the impetus for this qualitative inquiry. Now, if we talk about the methodology or the research design, this exploratory qualitative study aims to uncover the personal and operational stresses delivery executives face in their daily roles. So the participants, I took a cohort of 10 to 15 delivery executives aged around 18 to 40, employed full or part-time at the last mile B2B e-commerce hub in a place named Chamrajpet in Bangalore. Will be recruited for this study. So participants will represent diverse socio-economic and cultural backgrounds, including both rural migrants and local urban residents. So data
4 minutes up.
Yeah, one more minute. So data collection methods, I've used semi-structured interviews, then narrative analysis, field observations. Then after that, if considering the data analysis, I will take out the thematic coding, and then I will triangulate the findings from interviews, narratives, and observations, which will be cross-verified to ensure reliability and depth. The anticipated findings, this study is expected to reveal the sources of stress, the economic pressures, and the coping mechanisms, and the mental health outcomes, the operational challenges also. The qualitative examination aims to thus provide a nuanced understanding of the mental health challenges delivery executives face in Bangalore's fast-paced e-commerce environment. So by capturing personal narratives, the study will identify key stressors, elucidate their effects on mental well-being, and highlight the coping mechanisms these workers employ. So in doing so, it offers a foundation for actionable recommendations that can inform workplace policies, then support systems and sustainability practices within the e-commerce organizations. And finally, the key takeaways or the means basically the recommendations, actionable recommendations that can be like guidelines for e-commerce enterprise to implement mental health programs, optimize workload distribution, and revise incentive models. Then the policy implementations, evidence-based insights to shape organizational policies and public discourse on work well-being in the gig economy. Finally, contribution to research. Ultimately, this research seeks not only to eliminate the difficulties faced by delivery executives, but also to advocate for meaningful, empirical informed changes that promote their health and more sustainable work environment in Bangalore's thriving e-commerce landscape. That is the main motive. That's all from my side.
Thank you. And now I would like to hand over to our chair for her comments.
Yeah.
Ma'am, you're muted.
That when it comes to gig workers, customer is king is the
Yes.
motto of this thing. So that is quite problematic because there have been so many cases, no, of
Yes.
violence against delivery boys, and especially the target of time, no, that they
Yes.
have to deliver this thing. And have you gone through some of the studies by ILO on highest number of road accidents and deaths that due to road accident are among the delivery boys, not only in India, all over the world?
Okay. No, I will do that.
I think you should do that. The analysis of road accidents, because the way, and we also see, like even anecdotally, we can see the way these two children, this young man with two-wheelers, no, how they
Yes.
are desperately getting into extremely hazardous this thing, no,
Yes.
to reach their target that is
Yes.
there, and also the casteism, communalism, and all, no,
Yes.
some intersectional vulnerabilities from by your name or by your surname or by your religious
Yes.
this thing. People have been, they have faced insults and humiliation and violence. So I think those some of the hazards you can bring it. The most important thing is a time management thing, no, which is
Yes.
imposed on them. Yeah. So
Sure.
yeah, correct. And now they have also, though they are told not to have join WhatsApp group and all, but there have been unionization, and so many of them have now joined the unions, no, and
Yes.
online platforms. So that also you can bring up.
Sure.
Yeah.
Okay.
Yeah.
Thanks a lot, ma'am.
Thank
Yeah.
you.
Thank you, ma'am. Subharanji, you can now stop screen sharing. Next, we have Abhishek ji. Abhishek ji, kindly please go ahead with your presentation.
Option.
Abhishek ji.
This is killer chemistry. It's not there.
He's there.
He's there. He's there. Yeah.
Now he's not there. Abhishek ji.
Yes, I think they have rejoined.
He is rejoining. Now who is left?
This is the last one, ma'am.
Last one. Okay. Yeah, he has been in touch. I think he's working on this thing, no, recycling work, waste managers. So. In Kalyan. Yeah.
Hello.
Yeah, hello. Yes, Abhijit.
Yeah, yeah, there was some problem with the connection. Sorry. I'll quickly start with my presentation. Is my screen visible?
Yes, it is visible.
Just a second. Yeah. Okay. Good afternoon, everyone. So today I will not be discussing a lot about the literature review and the methodologies used and everything because of the time constraint. I will mainly focusing on the what are the case studies I have interacted with, the people I've interacted with, and their side of story. And along with that, I will be focusing on um, what I found in literature review and what is the ground reality in Kalyan. And I will try to correlate both the things and see how this study is giving me different insights than what I thought it would give me. So I will start with this. The first, the thought which, drive me for this research topic was that uh, who are these people who clean our gutters? Like, who are this invisible force which is definitely human beings, and we see them sometimes, but we don't know where they live, what are they living, what else they do after the April month, May month, where the managed scavenging work is done. After that, what do they do? These questions were always bothering me, and that led me with this research. And as there has been a lot of research has been done over the decades about manual scavenging. So it was always a challenging thing. What else will I can, what else I can bring to the table with this already done topic? But I realized one thing, that after 2013, the law, there has been still manual scavenging has been going on, and government is aware of that. It prohibits the manual scavenging. Still, it happens. Then I wonder that what is it that Manus just thinks about this act, that also, and also the scheme, which is Namaste scheme, which is still in progress of implementation by the government of India. I wanted to know, are people aware of this? Are people ready for such schemes? And what exactly is the reality and the perception about such schemes from the Manus scavenger side? So there are some interesting conversations I have had with people. So as you know, these are the faceless people which are around. I blurred this face because of this, for the sake of privacy. But these are the people who are around us. We still go in the gutter and they have to clean it. Though there are machines in cities like Kalyan Domboli also, in Mumbai also, and many other metropolitan cities, there are machines. But I could understand that machines are good enough for the big gutters. Only there the machines can be utilized well. Otherwise, in the small gutters, the infrastructure becomes a problem. With the small gutters, you have to get down in the gutter to clean it. Otherwise, it will still get clogged, and the machines can't help that. So people, as you know, they go in the gutters still. So today I'll be focusing on the three case studies mainly, not to bore you with the methodologies and everything. I'll be focusing on these three people, and I do not look at them as with any kind of pity or anything, because after talking to them, I could see that these are very normal people like you and me. They are not to be pitied about, and there is a reason why there is profession and a lot of other things. So, I'll start with the first one. There are three cases, as you can see: the firstborn, the breadwinner, and the responsible teenager. I start with the first one. By the way, all the images you could see, they are AI generated. So these are not a real people. For the sake of the presentation, I've used AI generated images of these people to give an idea who are the people who have interacted with. So this first one is a 29-year-old male. He's from Matang community. Matang community is traditionally belong to scheduled caste. And these people in Kalyan, they have always lived in near to the dumping ground. And the traditionally for generations, their profession has been working in a waste segregation work. That has been they're doing for ages. Now, this was the first born in his family who got into manual scavenging when he was 12. When he was 12, he started going initially. But after, after some years, he stopped. But then again, he started in 2012 and he started working there and didn't stop. since 2012, he has been for the last 12 years, he has been in this profession. But when I asked him that what led him to go into this profession, because his father never entered into gutter, as he said, but he said that there was no other option. They needed people young like me, because young people are like, in the small gutters getting down. It is easier for them to, like, again, since the school education wasn't there, he had to leave his school after seventh standard, but technically seventh standard on paper, but he left his school at fourth standard because the family's poverty led him to start earning. So these young people like him, illegally obviously, started going into the gutters, and he started working there. And like, then one thing also he pointed out that financial condition stopped his education. That's because his family could not afford the education which he can get. So he was the firstborn, so he had to start earning. And the younger one studied, but he didn't get into this profession because his elder brother, said that do not get into this. I'll do it alone. You don't need not to do this. So that's a common theme I can see, that the ones who are involved into it, they don't want their family members to be part of this. They want to be stay away from manual scavenging as much as possible. So
Abhishek
he's
ji,
the
4 minutes.
yes, yes. The second one is the breadwinner. He is a 45-year-old man who is a Katkari, from a Katkari tribe. He has been in this profession for 18 years. He never went to school. He lives in an area in Kalyan where it is uh, around it is surrounded by he lives, the entire Katkari community stay in a pada, in a hamlet together. They are around the complexes, big complexes and everything, but nobody knows about them, where they stay, who are these people, where are they come from? Because tribals in Kalyan is a very rarity. If I tell anyone in Kalyan, they will not believe me until they meet these people. So it is just still uh, excluded from the society, and that kind of like gave me one of the insight about the discrimination aspect, which I would like to talk about in some time. So 18 years he has been in this profession, and uh, he for the rest of the 10 months he works in the west segregation plant in Kalyan. But the 2 months before monsoon starts, he gets paid more than the usual job. That is the And again, in April he has one daughter. He had one daughter who was in school. So for her education, in the month of April and May, he could get that money, extra money, through which he could put his daughter into school. That's why he could take this job without hesitation, because he wanted his daughter to learn, get married, like eventually then also get married. So he's a breadwinner of the family, who again, forced into this thing because he had no other alternative and he had no education. He tried other things also, like selling vegetables, going on a construction site, but those options are not like hasn't worked in his favor. Though he's open to it, but he hasn't got this opportunity always. And the last person with a spoke to is 22-year male who started his first job as a manual scavenging around 5 years ago when he was 17. So technically, it is under 18 also. It's illegal to work in such an environment in 18 by 17. But his life was a bit tragic. After his father died, he had to leave school because the father was the only uh, breadwinner of the family, and his mother, and neither he has a younger brother. He had to take a responsibility of them. So at 17, what work he will get? So he started going with this another peers, the people in the community, the tribals, to the manual scavenging sites, and he started working there, and he got paid well. He continued with that job and other jobs in West segregation and everything, but he didn't want to do this, and he has strictly maintained that he's continues doing this because he want to again teach is make his younger brother educated. He want his younger brother to stay in school because he couldn't for circumstances. So that's the story of this person. One common thing which I could see is the discrimination part, as I mentioned, the tribals. Like usually the literature review says that the social discrimination is faced by manual scavengers, by the society. But whereas in the tribal manual scavengers, what I could see that they are all they are not getting discriminated as much as I thought, because they do not have any connect with the outside society. They live among themselves. they go to work with the same people who are they living with, and there is no point where they get discriminated among the other people because they have no interaction. These people, alternatives, when I asked about the alternative for this job, they could come up with the fact that they have tried, but some of the people they don't have light, like they don't have electricity at their home. How can they start a business? Who will lend them money? With these tribals, government schemes haven't reached at all. All they know and all they care is not the PM of the country, not the CM of the country, not the like the any other minister and everything. All they care about is a corporator because that's the person who has given them electricity, paper blocks, have given some schemes. That's all they care about. Other schemes, no schemes have reached to them yet. They are not aware of it at all. So because of all the environment they are in, they're deprived of the schemes and they don't have any faith in the Nimasti scheme as well, which I thought, like I explained that this is the scheme which might help them getting another opportunity. But they said that uh, we can give a try to like selling, let's say, vegetable vendor job and everything. But other jobs, they're still hesitant about. They do not want to look beyond the West segregation jobs, which is because it's convenient, it's nearby to their facility, and they're familiar with this. And one of the other aspects which I could come up with is that when asked about health issues and everything, they said they have a bit different perception about this. Most of them said, "Okay, like, yes, it is like, troubling. Like sometimes they get cuts and everything, but they consider themselves a bit stronger. They take a pride in saying that they are stronger, so it doesn't affect them anymore. So that was another perception I could come up with, and they know that it's illegal work that what they have to do and everything, but they still have to continue because there is no other option for them. And the last thing which I could see that when I asked them what would they like to do different if they given opportunity, what the government should do about it, one thing they could see is that we need contract-based jobs in the municipal corporation, like the West segregation again, the jobs where they are um, picking up the the household a society wise dustbins and everything. That job they would like. They want a corporate job. They want a bit like good job in this sector in the same west is something they want to look at around. They don't want to look beyond that, but if given opportunity they might. But the education and other things they are a bit skeptical about, so that's why they want to take any risk, and they're still continuing this profession is what I could come with. Thank you.
Thank you so much. Now we'd like to hand over to our chair for our comments.
Yeah. Hello. What you need to focus is on the way you say that they don't feel discrimination. I think it is a question of helplessness also. When you know that all doors are closed and you have no other way to come up, it's the way the natives and indigenous people all over the world have been treated, in this. So not giving exposure, not giving opportunity, not giving equal treatment, that itself is this thing. Why do TSP budgets remain unutilized? Okay, tribal subplan you have in most of the places, except for Northeast, everywhere it remains unutilized because unless you send proposal,
Yes.
you won't. So I think there is a systemic discrimination. See, discrimination happens at the interpersonal level and systemic and structural level. So structures and systems have discrimination embedded against scheduled tribe and Dalit and people with multiple marginalities. So that philosophical position you have to take because they are the victims
Yes.
of the system, no? So I think a
Yes. Yes. Yes.
little in a conceptual part, when you introduction and all, you have to focus on systemic and structural discrimination, and that cannot be
Yes.
handled by individual. Even a community, you need many more forces to make that policies and criminal justice system and laws and political milieu, bottom up and top top down proactive approach, all these combined effects, because these are the historical injustices, no? Right from the time of
Yes.
British rule, the stigmatization, isolation, and criminalization of tribal communities have happened. Now also, anytime the way deforestation is happening, the land is grabbed,
by the predatory forces, and they are called Maoist. When they fight against it, they are called Maoist. Mega development plan. Why the massive land grab is happening in the name of development plan, and when they assert, they get criminalized, they get killed, and they are labeled as Maoist. No, so this, I think these are the systemic discrimination which needs to be dealt with, and for that you need a multiple agencies have to work to get out of it.
Yes.
Yeah.
Yes. Yes.
And
Yes.
I
Absolutely right.
also,
Yeah.
yeah, even when you say that, okay, only for a major excavation you can use robo, but then how come in many states they are using it, no, in Kerala, or why in so many other countries, small countries also have a far more humane way of waste management than this, no? We had one lecture
Yes. Yes. Yes.
where the bureaucrat from Himachal Pradesh, Madam Dr. Chaudhary, she told the experiences of Sweden. How are they managing? No, it's a question
Yeah.
of
Yeah.
political will. It is not the small project or big
Yes.
project. Yeah. So I
Yes,
think,
yes, yes. Also, they mentioned that the other perspective also, ma'am, which I got is that some of the families of these manual scavengers, because they have been there, that's main occupation where they get paid more and everything, they resist the machines. They don't want the machines to come in the picture, is also what I could see.
no,
They're
that
like machines
is
आ गए तो
also
हमारे
scared.
job निकल जाएंगे.
Because and plus
Yeah,
it is also
हमारे job.
linked to housing also, no?
Yes,
Municipality,
yes,
they
yes.
gave them house. So
Correct.
because they are not,
Uh,
they are given below subsistence wages, they can't get out of that housing colony, because where can you afford to buy a house or even rent a house, no? So that becomes the major. I have come
Yeah.
across a MA psychology and MSW and even MPhil person continuing with the profession, mainly because they said they can't get housing. First of all, the stigma also. Who will rent the house to Dalit or quote unquote untouchable, or who will rent, will any builder allow sell that house also, even if they want one room kitchen tenement and if they mobilize money. So it is economic factor plus the caste-based segregation and exclusion. All these things need to be dealt with, and it's only the state can do it. The private players will not do that. They are,
Yes.
yeah,
Yes, ma'am.
yeah,
Yes, ma'am. The act also mentions that the prohibition of employment as manual scavengers and their rehabilitation. The
yeah,
rehabilitation aspect, government miss out completely. They just
correct,
want to ban and everything, but the only solution is a rehabilitation for them.
correct.
Then only
Alternatives
they will
have
feel
to be,
secure.
yeah.
No, yes, the alternatives have to be there, but yeah.
Yeah, and so many
Anyway,
smaller
thank you.
countries have done. No, when Singapore was a monocrop island after Second World War, and when Singapore
Yes.
decided to become
Yeah.
a financial hub, so many people who could not adjust to the new technologies and all, they were not thrown out in the sea. No? They had so many other plans to give them a dignified life and employment, and see to it that 100% employment is there. So the renewal mission should not be just on paper. Renewal mission is not only for the white collar and blue collar industrial workers. No, a renewal mission has to be for even manual scavenger, and that for that very concrete grounded plan has to be there, and in consultation with them. That's very important. And many other countries have
Yes.
done. Even
Yes,
Africa, why Africa also has so many laws about domestic workers, about the West workers. They are much ahead than us because of their bitter experiences of slavery. So solutions
yeah.
are there.
Thank you.
Thank you. So I think all this you can bring out in your recommendations. Yeah.
Thank you, ma'am. Now I would
Yes,
like
yes, ma'am, definitely.
Yeah. Yeah.
Thank you, ma'am. Now I would like to extend my heartfelt thanks to all the participants for presenting today. Now I would request the chair, Professor VIBHUTI ma'am, to kindly share her closing remarks. Over to you, ma'am.
Yeah, I think we have had a very rewarding session, and all of you were so deeply engaged, and the way you kept us on our toe by sending your email messages, by being active in the WhatsApp group. And I think WhatsApp group facilitated a lot, so many things which at knowledge sharing happened, even the sharing of experiences, the challenges that you were facing while conducting research. And we all know qualitative research is not a just cakewalk. It is a very serious ballgame. And you have managed, you have reached up to the final stage, and I think it's going to be adding to the new knowledge. And when the anthology comes out, I think all of us will collectively like congratulate ourselves. So I wish you all the best. For you are at the final stage of the report writing and getting your plagiarism check and all. I think it won't be, because you have done the primary research, so it's only in review of literature you may find some similarity index and all. But otherwise, it's going to be a very, and the way you all have moved step by step, and you described also today, I find it very, the whole effort of these 10 days have been very rewarding to both the organizers, resource persons, and participants. Thank you very much.
Thank you, ma'am, for graciously conveying all this section. And we are also grateful for experts who have shared their valuable insight throughout this fellowship program. An important notice for the participant that feedback form will be shared with you all. So with this, I would like to proceed to formal vote of thanks as we come to the end of day 10 of Public Policy Qualitative Participatory Action Research Fieldwork Fellowship Cohort 4.0, an online national winter school program, a 5-month online immersive qualitative participatory action research fieldwork certificate training fellowship. I, Sana Ansari, researcher at IMPRI, Impact and Policy Research Institute, would like to propose the formal vote of thanks on behalf of IMPRI, New Delhi. We are grateful to our chair for the day 10 session, Professor VIBHUTI Patel ji, for taking out her valuable time and allowing us to learn from this online certificate program. We thank all our participants who have raised important questions and actively participated throughout this fellowship. And the research essay draft submission is on 22nd December 2024, that is Sunday, which marks the final milestone of the certificate fellowship. This submission is an opportunity to synchronize your learning and demonstrate the insights gained during this journey. We appreciate the effort and dedication you have invested throughout the program and look forward to receiving your thoughtful contribution. Please ensure your drafts are submitted in accordance with the guidelines shared. We are grateful if you watch us later on YouTube or listen to us on various podcasts or read our publication. We hope you continue to join in for the future to improve web policy talk and web policy learning. Wishing you a very good day and thank you so much.
Thank you, Sana, for seamlessly conducting the sessions all this time. And once again, congratulations to IMPRI team for the hard work and for all the participants for such an engaging sessions we had, and also conducting your research in such a proactive manner. Thank you.
Thank you.
Thank you.